Okay, I want to talk about something that's been top of mind lately. I prescribe GLP-1s like Ozempic and Zepbound in patients who qualify. My counseling around these meds, it continues to evolve. And of course, it includes the basics like typical side effects, cost, alternative options. As always, my counseling includes intensive lifestyle assessment, talking about mental health, exercise, dietary patterns, and definitely assessing your relationship with food and with body. But there's one major effect of these meds that I think people aren't necessarily talking about or being properly counseled about, especially if they're getting it in passing during a 7-minute visit with their doc or via one of these telehealth weight loss company platforms. If you have a history of disordered eating, body image disorder, these meds could exacerbate that. When people start to tell you how thin you look on these meds, because people love to comment on other people's bodies, when your appetite has decreased so significantly and you get full really quickly, these types of factors start to reinforce those thought patterns that you might have developed most of your life, diet cycling for a long time. So you keep eating less, you keep wanting to be thinner. Listen, it's important to understand that these desires aren't inherently bad, but I encourage my patients to assess why they really want to be on these meds in the first place. And we come up with what I call barometers of success. I have them write it down. If your barometer of success is that you want to be more comfortable in your body, able to move more easily, less pain on your joints, get down and up on the floor with your kiddos, if you want to feel more comfortable when you look in the mirror and you are actually someone you recognize, if you're wanting to improve some of your, blood sugar levels, right, or A1C or your fatty liver disease, these are barometers of success and they're measurable. And when you identify that, and it starts to happen that people are reinforcing some of that disordered, eating mentality or body image disorder mentality that you might have developed over a long period of time, go back to those barometers of success and say, was I on this because I wanted to be called thin by some rando in an unsolicited way? Or did I decide to go on this because I want to feel stronger and better in my body? Whatever that barometer of success is for you, stick to that and understand that a potential side effect of these medications is exacerbating some of your previous disordered thinking. But if you can identify and have insight into it, you'll likely have a more successful journey.